Saturday Extra is brought to you by Texas Laparoscopic Consultants and Nobilis Health, helping Houston live healthier.
Good morning and welcome to Saturday Extra. I'm Cynthia Cisneros and I'd like to introduce you to our guest, Dr. Sherman Yu. Thank you so much for being here this morning.
Thanks for having me.
Wonderful to have you here because we are here to talk about a new procedure called Endoscopic Sleeve Gastroplasty. And not only is it a new procedure, but it's also innovative. And you're here to tell us why that is.
You know, one of the most exciting things about this procedure is that it's done without incisions. Traditional weight loss surgery, even though we do it laparoscopically and we consider it minimally invasive, you still end up making 4 to 5 small incisions. With this, we do the entire procedure through the mouth. There's no incisions. Patient's recovery and downtime are minimal.
So once you enter into the patient, then it's just a matter of pulling back certain parts of the organs and no surgery involved.
Yeah, once we get inside, we have a suturing device, and basically what we do is we kind of decrease the volume of the stomach by sewing it down. We partition it, and that's why it's kind of called a gastroplasty.
So what is the ideal candidate for this procedure?
So the ideal candidate for this procedure is someone who's about 20 to 30 pounds overweight at least. Of course, you know, we operate on patients that are heavier, and it's really patients who've tried multiple modalities to try to lose weight. They've tried diet, they've tried exercise, and you know, despite all that, they still can't get the weight off. And that's really the kind of patients that would do well with this procedure.
And when it comes to this particular procedure, there is risk, as always, and benefit, but what are some of the risks that are involved?
You know, just like all procedures, there's always some risk. This surgery is done under general anesthesia, so there's always some minimal risk from that. In addition, there's always a risk of bleeding, and one of the things that I worry about long-term for patients is that there's a risk that some of these sutures, you know, could open up down the line. We might have to do this procedure again. So it's not really a dangerous complication, but it is something that could happen later on.
But that leads to the next question of recovery time. Explain the recovery time and I guess how this is really minimally invasive.
Yeah, this is probably the most minimally invasive thing that we can do. You know, we have patients who go back to work the next day after this procedure. You have no abdominal pain. Patients notice maybe a little bit of gas bloating, possibly a sore throat for a day or two, but short of that, you know, patients are on their feet. I tell them they can go to the gym in the next day or two, go do what they want.
So there's no immediate risk of those sutures rupturing?
Typically not. You know, to that effect, we do have patients following a diet afterwards because we do want the sutures to kind of set in and for the stomach to kind of heal back together a little bit where we suture it. And so we do have patients kind of following a pretty strict diet for the next few weeks after that while everything's healing.
And so that's got to be the #1 benefit of this particular procedure is that healthy lifestyle and just overall better feeling.
Absolutely. You know, one of the things that really excites our patients who've struggled trying to get weight off is now they start seeing the weight come off. And that really just motivates them to continue to exercise, continue to eat healthy and go out and really enjoy themselves.
And as with most things, this is a lifestyle change.
Absolutely. You know, one of the benefits kind of was touched on is, you know, once patients start seeing the weight off, they maintain healthy exercise, healthy diet, and, you know, they're able to get out there and really do the things that they were limited from doing before because of their weight.
So let's give everyone an opportunity to take part in this and know that Texas Laparoscopic Consultants would like to offer you a $500 discount towards your endoscopic sleeve gastroplasty. ESG procedure. And you can do this by calling or emailing using the promo code KTRK. It's one of our favorite call letters there. Our offer will expire 12/31 of this year. So really, it's plenty of time for everyone to call in. Dr. Sherman Yu, thank you so much for being with us this morning. We appreciate it.
Thank you so much.
And thank you for joining us on Saturday Extra.
Saturday Extra has been brought to you by Texas Laparoscopic Consultants and Nobilis Health, helping Houston live healthier.